Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey. It's Medical Monday at East Cooper Medical Center, and today we're sitting down with a low-country urologist to learn how robotics are changing the surgical process and how these technological advances are impacting both the patient and the physician.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Dr. Stephanie Seixas-Mikelus. She is a urologist here at East Cooper Medical Center. Thank you so much for being here.
Thank you for having me.
All right, we're talking about robotic surgery when it comes to urology, correct? And it seems like robotic surgery really is becoming a thing nowadays, right?
That's correct.
So what is robotic surgery?
So robotic surgery is a type of minimally invasive surgery. Okay, so minimally invasive surgery means that the surgeon, instead of operating through large incisions on patients, they operate using miniaturized instruments that fit through a series of small incisions, a 1/4 inch size. And so during a robotic operation, the surgeon uses master controls to manipulate the instruments. And
so is it like a joystick, or are you like,
think of it that way, using the arms and legs to control the instruments, and the instrument translates the surgeon's movements into precise movements within the body. And
are you able to be more accurate than you've ever been?
Absolutely. It accounts for more precision. But the most important thing is the surgeon is in control the whole time. Basically, the surgical system responds to the surgeon's movements.
Okay, so when you say minimally invasive, this means that where before they would maybe have to stay at the hospital longer, right? Sure. So this makes it to where their downtime isn't as much?
Yes. I mean, there are many benefits to robotic surgery. They include smaller incisions. Okay, so that decreases the risk of skin infections, less scarring, okay, less pain. So there's less of a need for narcotic usage in the post-op period, okay, as well as significantly less blood loss, okay. All of these translate into a shorter hospital stay, okay, a quicker recovery, and of course return to normal activities much quicker.
I know I've learned about robotic surgery in other areas, but is this a relatively new thing when it comes to urology, or has it been around a while?
That's a great question. Actually, the urologists are the ones who really were the pioneers in
That's what I'm talking
surgery.
about.
We did the very first robotic surgery, and we use it for various procedures.
So what are some of those procedures?
Sure. So we treat various oncologic cancers. Urologic oncology cases, okay? So that includes kidney cancer, bladder cancer, prostate cancer, of course, and then we also use the robotic system for benign processes, for things like ureteropelvic junction obstruction, or when we do a pyeloplasty, or sometimes if we have to re-implant the ureter into the bladder for strictures. So there's a variety of surgeries that we do utilize the robot for.
So normally you would have to, I hate saying it like this, like really cut them open and get in there, right?
Absolutely. They were much larger incisions. Nowadays, it's like a 1/4 inch size, and it's really refined surgery.
When it comes to robotic surgery, is there ever a time where someone's not a candidate, or is everyone able to have robotic surgery?
It's a great question. Obviously, you have to first determine whether or not the patient's a surgical candidate, okay. To begin with. And then obviously patients that have a lot of pulmonary disease. Sometimes some of the positions that we place our patients could be a little tough in terms of ventilating the patient. So you have to choose, make sure that it's a safe approach for every patient.
But most of the time it's ideal over traditional surgery, but there are some times when...
Absolutely, and every surgeon has to have that conversation with the patient in terms of determining what's the optimal approach. You could do it robotically, laparoscopic, or traditionally open.
All righty, well, always a pleasure to sit down with you.
Thank you
I feel
so
like
much.
I've learned a ton.
Thank you for having me.
And for more information, you can head online to eastcoopermedctr.com.